What are the T cells that violate those rules? And what does that mean for those patients? And so here I've plotted the patients with COVID-19. And what you can see here is that here's the cytotoxic T cells, here's the helper T cells. The helper T cells mostly stay in their lane. They're mostly over here. The cytotoxic T cells actually stretch out quite a bit into the helper T cell area. And what that means is that you've got CD4-like CD8 T cells or helper-like cytotoxic T cells. And it turns out most people don't have those, but you see them in older men more often than older women. Something like 20 individuals out of 300 adults that we had. And those older men do much worse when faced with COVID-19. They had much more severe disease. I mean, you can look at this. This is on a scale of 1 to 7. For 7 means you're probably not going to survive, and 1 means you don't even know you've been infected. And so if you have really strongly biased CD8-like CD8 T cells, you really never get beyond a mild or moderate infection, and you do definitely head into serious infection land if you don't have those. And if you look in the blood of those patients, you saw that inflammation got out of control. And if you actually look at the T cells themselves, we have all the single cell data on these T cells. They simply do not act like CD8 T cells. They have no capacity to kill. And so these patients that had these rules violations, what we're finding is that they simply did not have the capacity, that initial front line of defense of CD8 T cells that identify and kill the infected cells. And it had health consequences for them.